Welcome to the new ANF Academy interview. Today I'm interviewing Eugene. He's a craniosacral therapist from Singapore and he recently won 4 very prestigious awards. So let's hear what he has to say. Hi Eugene, you recently won 4 very prestigious awards. Can you share with your peers what is the recipe for success?
Recipe for success is I have worked very hard with ANF, and that has allowed me to get the success that I have today.
So ANF Therapy helped you achieve the success and won 4 awards?
Yes, correct.
Okay, so how does ANF Therapy helps you with your patient results?
The thing is, ANF Therapy has helped me to achieve unrealistically good results, you see, because the results that I have not been able to observe from most conventional medical treatments. So ANF Therapy has been there to help me to achieve very fantastic results very quickly.
Are there any certain conditions where ANF Therapy does miracles and traditional therapists have some results but limited?
Okay. Personally speaking, I am the face of the miracle of ANF because the thing is that I have been diagnosed with hereditary spastic paraplegia 13 years ago. And what was once told to me was that I will be wheelchair bound one day and it is something that is impossible to treat. But the thing is that I am able to walk today, and in fact, I just went to the gym today.
They told you that there is no cure for your disease.
Yes, there is no cure. So for me, ANF has given me the miracle which many people were not inclined to believe, but the thing is that I am the image of the success of ANF.
Besides your personal story, when it comes to your patients,
yes.
What did you notice? In which cases ANF does miracles where other methodologies?
So I have had the privilege of seeing many patients with Parkinson's.
Okay.
Which are not exactly very treatable. Parkinson's is not exactly very treatable. The most they are given medication. Yeah, but ANF has allowed me to give them results.
What kind of results? Does it mean they're cured?
Because many people with Parkinson's have weaker legs, you see. So after treatment, they have feedback that they feel stronger and lighter.
And in terms of other symptoms, you can help them with ANF therapy.
In terms of strength to do activities of daily living, yes.
Okay, so ANF therapy helps you manage their symptoms.
Yes.
Do they come back, or?
Of course they come back. Yeah, of course. I have had the privilege of seeing international clients. Of course, those don't come back.
Okay. But what is the difference between the conventional medicine for Parkinson and ANF therapy if they're both manage symptoms?
Frankly speaking, the conventional medication for Parkinson's don't exactly give results. Yeah, because similar to most conventional medications, most treatments like cancer treatment, right? Most conventional treatments for cancer is basically just to put a stop to it, but it doesn't exactly make it better, which is the same for Parkinson's. Maybe they say, maybe we'll delay the progress of Parkinson's, but to make it better, no.
Mm-hmm.
Yeah.
When it comes to orthopedic cases, what do you usually treat and how ANF helps you?
Okay, I have very many cases of knee pain because of osteoarthritis.
Okay.
I can tell you that I am able to show them results in seconds.
What does it mean? They feel the pain. They feel
feel. So upon palpation, there is some pain. After application of the disc with palpation, there is less pain immediately.
Okay, so I can say that you're in love with ANF therapy and that you believe that ANF therapy helped you achieve
and win those awards.
I would gladly sell my soul to ANF. ANF is my life.
Before you discovered ANF, how would you treat, for example, if you have a patient with osteoarthritis? How would you treat that patient?
Before ANF, I used to be a massage therapist.
Okay.
So, to say that I can exactly treat pain, maybe with massage therapy, you can increase the range of motion, but to exactly target inflammation, I would think that massage therapy, no.
Okay. No.
Yeah, so after massage therapy, I discovered ANF, and I have been using ANF for about 7 over years since. Yeah.
We mentioned ANF therapy now a few times, but can you, for those that are unfamiliar with ANF, can you in a few sentences explain what it is and how does it complement your treatments? Or for example, why should a physiotherapist have ANF in their in his toolbox?
Yeah, okay. So what is ANF therapy? So the thing is that ANF therapy utilizes these things called frequency. So basically these frequencies are stored in the discs in a material. So it's like you can put it like some sort of like a battery. Then upon application of the disc, the battery is activated.
Okay, you apply disc on the skin.
Yes, you apply the disc on the skin and it's activated with body heat.
Okay.
And that is when the frequencies start to transmit to the body.
But if I ask you why a manual therapist, any manual therapist, why should a manual therapist add ANF therapy to their toolbox? What would be your answer?
Okay, so what the question was actually, how will physiotherapists or manual therapists make use of ANF, right? So
yes,
the thing is, because of pain, right, the patients usually have a poorer range of motion. Doesn't that mean that they will not be able to do the exercises that you are prescribing to them well? If you can reduce the pain, doesn't that make the exercises so much more effective? So I would think it's more of reducing the pain and improving the range of motion so that they can exercises better, because no doubt physiotherapy in the long run will help them. But the thing is that why not speed it up?
Okay, so does it just reduces the pain, or it actually helps the body heal itself?
Yes, because now basically I'm just giving you basic things like reducing of pain, because the thing is that there are also discs that can help to lengthen the muscles so the muscles are not so tight, which also helps to improve range of motion. But the thing is that basically, as you can see, the number of discs that I have, I can tell you that the functions that ANF can actually provide is quite insane. It's insane.
Can you tell me, for example, if you have 3 patients with osteoarthritis, are you going to apply the same discs or devices on them, or you create tailor-made protocol?
Every patient to me is a tailor-made protocol, because the thing is that I will have to palpate to find out which area has the most pain, and then upon palpation, which disc to apply is definitely different, because depending on which level of inflammation we are targeting, you see. So I would say every patient is a tailor-made protocol. No 2 patients are the same.
Okay, Eugene. Thank you very much. Only 1 or 2 questions more. The first one would be, what are your plans for the future? What are your future goals?
I see. Our future goals will be to expand my network so that I can treat more people. I will be wanting to work harder and harder and harder so that I can achieve more. Yeah, I will want that will be my future goal, will be to achieve more. And also the thing is that I can tell you that after 7 years of ANF, I am still learning more about how to use ANF, you see. So the thing is that maybe in the future, I am able to use ANF to give more and more fantastic results. God knows, right? I am able to, someone come in and they are wheelchair bound, and after 1 session, they can walk. Who is stopping them from running, right?
The next step would be to achieve more, to treat more people, to provide more relief, to help more people.
To help more people, and to to give more fantastic results.
And the last question would be, what is your message to those that never heard of ANF, or this is the first time they hear about ANF, or to those that heard about ANF but still considering should they join or not?
Okay.
Do you have like 2-3 sentences you want to share with them?
In life, right, we are always trying to learn more. We are always trying to learn more to upgrade ourselves, you see. So the thing is that, what is the harm of learning something new like ANF, you know? And then, but I have to warn you first, once you start ANF, right, I can tell you it is a very, very addictive cycle. You will be so addicted to using ANF. I'll be honest with you, you know, when I was diagnosed with my condition, right, I took a dive into the unknown, right, without even trying ANF. I took a dive into the unknown and I flew to Brisbane for my level 1 and 2. And then I haven't tried it myself, you know. Then after I flew to Spain to learn from Mikel himself, I have never ever looked back since. During these past 6 years or what, did I exactly have fantastic results? I can tell you no. And then, but the thing is that this year in particular, I've been having so fantastic results. So the thing is, my message to people will be to persevere on and to try harder and to keep trying and learning, because that is the only way to get better. I advise anyone to pick up ANF. So I mean, like, why not learn something new? I have treated about 5,000 patients. So if I can treat 5,000 patients, I mean, no offense, but you can go and check out my Google reviews, right? It's fantastic. So I mean, if the results are already there, right, then what is stopping you from trying it? You know what I'm saying?
Thank you, Eugene. Yes, thank you so much for this interview, and I'm looking forward to seeing more of your results and rewards.